The following sequence shows the completion of the anterior instrumentation. A caliper is used to figure out the correct length of the plate needed, which will be inserted through the working portal and placed upon the so-called clamping elements of the implant used. It's a so-called frame plate which will be attached to the clamping elements. Now we use sleeves to be guided directly to the screws here, and now the plate will be fixed onto the clamping elements with nuts using a torque wrench, applying a torque of 15 Newton meters. After having fixed the nuts, the whole assembly will be brought closer to the bone, inserting the bone screws a little bit more, and then the guiding devices for the anterior screws are attached to the assembly. It is a 4-point fixation system, therefore anterior screws have to be inserted in a defined angle. Usually anterior screws used are 5 mm shorter than posterior screws. Now the guiding device is removed and the polyaxial mechanism of the implant is locked using so-called locking screws. Anterior instrumentation is now completed.